everyone, my name is Dr. Christina Turkovich and I'm a chiropractor in Newmarket, Ontario, Canada. Welcome to my channel. Are you having shoulder pain and you just can't figure out how it started or why it started? Stay tuned because in this video you will learn what it means to have sudden shoulder pain without having had a traumatic injury. Now don't forget to subscribe to my channel and click on that notification bell so you can be notified every time I post a video. Ultimately, there are several conditions that you can have that are causing discomfort, that are causing pain in your shoulder that aren't a result of having had a traumatic injury of some sort. Today I'm going to be sharing 6 of the most common conditions that you can consider when you're having shoulder pain. The first of these common causes of shoulder pain is rotator cuff tendinitis or bursitis. So rotator cuff tendinitis is when the tendons of the musculature that support the shoulder become irritated or damaged. It's often assumed that this injury happens because of an activity or pattern that you're doing on a regular basis. So a repetitive strain injury. So more accurately, it's age-related degenerative changes in the tendon that predispose it to becoming injured. And it can become injured with just normal everyday activities that we're doing. Now, rotator cuff bursitis is when the cushion of the tendon, so there's a tendon that comes across the top of the shoulder. This is usually the tendon and the bursa that would become most irritated with a rotator cuff issue. It's called your supraspinatus tendon, and it comes down through here. Now there's a cushion underneath that to protect it from rubbing on the bone, and that lining, that little cushion, can become inflamed and irritated. Now, having an issue with the bursa, which is where bursitis gets its name, can be usually linked to an issue with the tendon first. So if you have a tendinitis issue first, then a lot of the time, unfortunately, you'll also have some bursitis in there as well. And you can recognize it because the pain happens in the upper part of the arm, and you will feel the pain in this area a lot of the time, even a little further down. So if I get up here a little bit more, you can see more clearly up here and around this part of the arm, you'll have the pain in this area. The second common condition that can cause shoulder pain is a rotator cuff tear. Now, a rotator cuff tear is unfortunately a lot of the time the more severe end result of having chronic tendinitis. So the same overuse that can lead to tendinitis can also lead to a rotator cuff tear. What happens is the chronic inflammation and degeneration creates issues in the integrity of the tendon, and so it's more easily torn. The pain of a tear is a much more deep aching and throbbing in your shoulder, and it can actually lead to disrupting your sleep. So just a side note, it's a good rule of thumb that if pain is, keeping you up or waking you up, I guess intermittently throughout the night, so off and on throughout the night you might wake up with pain, it's really important you want to get it checked out. So go to a chiropractor, go to a medical professional so you can have this looked into. The third common cause of shoulder pain, you might have already thought of this as well, is arthritis. Patients can have really intense shoulder pain without really having had any injury to the shoulder, and most of the time it's because of arthritis. Usually arthritis in a joint is the result of having had a trauma of some sort to that joint area. But that being said, it can come on out of the blue without having any injury to that area as well. The kind of pain that you could have from arthritis in the shoulder would be more of a dull ache, or can be more of a dull ache, especially in the earlier stages. And you might not really be able to pinpoint where in the shoulder you have the issue or you have the pain. It just feels kind of broad and all over. Also, if you're developing arthritis in your shoulder, you might start to notice that it's a little more difficult to move around. The range of motion so if you could, depending on how high you can lift it, you notice that there's a decrease in that range. So all of these are indicators, and it could be getting quite stiff, right, in that joint as well. So all of these are indicators that there's a possibility that arthritis is starting in that joint. The next common culprit for shoulder pain is frozen shoulder. And many of you might have already heard this term before. The fancy medical word for frozen shoulder is adhesive capsulitis, which is a mouthful, definitely to say. Frozen shoulder happens when there is inflammation in the lining of the shoulder capsule, of the shoulder joint itself. Unfortunately, because of the inflammation, the shoulder capsule starts to thicken and tighten. And with this, it can create quite a bit of discomfort while this process is happening. It starts with progressive pain with motion and becomes very stiff. And you really start to lose over time your range of motion it can actually happen quite rapidly. The pain from frozen shoulder is usually a dull ache kind of a pain. And it's usually worse in the earlier stages of the condition and when you move your arm. And the pain can usually be more specifically located to the outer part of the shoulder and sometimes the upper arm as well. Condition number 5 now is calcific tendinitis. Now, this is a condition where you actually have or start to have calcium deposits in the muscles and tendons. And they can usually be seen on x-ray quite well. So it's a very easy way to rule this one out. If you have an x-ray, they can see it quite clearly on x-ray. Calcific tendinitis usually happens in people who are over the age of 30 as well. So if somebody's under 30, that's a good way to potentially rule that out. With calcific tendinitis, moving your arm or sleeping can be quite difficult because the pain can be so severe. If you do feel pain because of this, it's most likely going to be in the front of the shoulder or in the back of the shoulder, and it can radiate down into your arm. And also, it can come on suddenly. It's very easy for it to come on suddenly, but this is one as well that could come on a little more gradually and build up over time. Now, the last condition, the 6th most common condition for shoulder pain, is actually a spinal problem. Because the pain might not be coming from your shoulder at all. It might be coming because there's a misalignment in your upper back or your neck. And more specifically, the cervical spine and disc issues in that area can be a big root cause for having shoulder pain. You might notice that you have more pain in your shoulder blade area with this type of issue. But it also can radiate into the shoulder itself, so into this area, into the upper part of the shoulder, and even down into the arm as well. So just to finalize, just to finish up, if you are having any kind of pain, shoulder pain, or really any pain in the body, I mean, it is a good idea to take a wait and see approach, because sometimes it'll resolve on its own. Sometimes it could be just that, maybe you exercised a little bit hard one day and your body is telling you that. And so you just really need to keep all of the things in mind, all of these things in consideration before you start to worry or get nervous about having any kind of excessive pain anywhere. So waiting and seeing is a good option. However, like I mentioned before, if you are having pain that is interrupting your sleep, it's really important to get it checked out. And if you can't sleep at all, then chances are, you will benefit from getting that treated. So please seek out a medical professional, seek out a chiropractor, a physiotherapist who can diagnose your issue and help you give treatment to that area and give you some pain relief. So there you have it. These are the 6 most common causes for sudden shoulder pain without injury. Thank you so much for watching, everyone. I really appreciate that you've taken the time out of your day to sit here with me, and I would really love it if you would subscribe to my channel. Please click the bell icon so you can be notified every time I post a video. Also, if you have any comments or questions or anything you'd like to know more about, please leave me a message below. I'd love to hear from you. And again, if you really love this video, please like and share it with anyone you feel could benefit. So thank you all again so much. Have a wonderful day, and I will see you on the next video. Bye!